So let's get started. So I think, sadly, I think everybody can tell from our daily release of numbers that the number of cases is going up and really going up really across the province. This is what that case curve looks like, and you can very clearly see there's that upward trajectory in cases. One good thing I guess you can take, if to the extent there's any good thing, is that this slope is a lot more similar to the slope we were seeing last fall, as opposed to what we are seeing between the second and third waves. And so that does at least imply that maybe there's a little bit of time for us to find ways to bend that curve downwards. But certainly we need to start taking some action, I think, if we're going to see it head that direction. In terms of Niagara, this is what our case curve has looked like. And you can see we managed to flatten things out there for a couple of weeks. But as I'll show on the next slide, some other parts of the province, particularly around us, have had higher cases all that time. And it was only a matter of time before that started to spill over. And I think we're starting to see it start to head upwards again and really get close to where our neighbors maybe are. That group of our neighbors here, this is really looking across the Golden Horseshoe, and then a few other neighboring areas like Brant, Haldimand County, Middlesex, London, and I've thrown Ottawa in here as just the other major urban area within the province. And I'll just draw in these lines very quickly. These are what different parts of the province have really looked like since about mid-July in terms of cases. You can see everybody is trending upwards. We're the heavy green line here, and you can see we've tended to stay on the low end of that pack, but nonetheless, we can buck the trend of going upwards. And then I want to highlight here Hamilton, which has unfortunately really become the epicenter of COVID in the province. It has gone up far quicker and far higher than anyone else. And of course, us being just across the border from Hamilton, there was a high likelihood that their cases were going to start to spill over to us. And unfortunately, I think we are starting to see a little bit of that. So just want to zoom in a touch here and just looking really at the last couple of months or so, from late June until now, of what's happened with Ontario's cases. And this is kind of the trend it's looked like. End of June, early July, we were still coming out of our lockdown and seeing cases come down. And then in the middle part of July, we kind of had the inflection point, and since then cases have been going up. And I think it's important to note that this is really all tied, I think, to our reopening. So we reopened to step 2 on June 30th, which was earlier than the province had initially said we would. And it's about 3 weeks until you see the impact of that change. And the change you can see here was a very gentle upwards trajectory. And I think if we'd followed the provincial framework correctly, we could have gone through step 2, seen cases were maybe slightly going up, and had an opportunity there to step in and address it before we went to step 3. But of course, the province rushed ahead with step 3 before we'd even seen the effect of step 2. And you can see that we end step 3 at the point where we start to see cases start to go up much more quickly. And I think there was a strategic error there again, where the province once again was a bit impatient about reopening. And we're seeing that we weren't able to manage the reopening and the resurgence of cases as a result. If we're looking then at Niagara here, similar sort of analysis, a bit of a noisier line just because we are a smaller number of cases, so it's going to jump around a bit more. But you can see clearly a downwards trend before step 2, and 3 weeks after going to step 2, we've kind of ended up being flat. Of course, we go into step 3, and you can kind of see that as we came out of step 3, that's when cases went up. And so our upwards trajectory of cases is really all tied into reopening, and particularly, I think, reopening into step 3. If we were in step 2, we'd probably have things relatively flat still, but the move to step 3 is, of course, caused cases to go up. You can kind of get a sense here of what's happening. This is the Oxford Stringency Index. This kind of measures the intensity of a lockdown. So you have the second lockdown here, you have the third lockdown here. Between the 2 lockdowns, of course, things open up, so there's fewer restrictions. And of course, right now we're at the fewest restrictions that we've had in a long time. And then the orange line is, of course, how much people are out and about, how mobile they are. And of course, that has gone up. And, as you can see that when we are in lockdowns, people don't go out and about as much, they're home. When things open up, people will start to go out and about more. And of course, we are more open than we've been in a long time. And so there's a lot more mobility than there's been in a long time. And just to see another way of this, this is here people staying home. You can see really at a low, for the last 8 or 9 months, people going to parks, walking, transit, retail, recreation, even a little bit to workplaces. All of that has gone up as we've reopened. And if we look at Niagara here, you can see people staying home. That is the lowest it's been really until you go back to before the pandemic began, before March 14th is the last time people were staying home as little as they are now. And if we're looking at shopping and recreation, you can see this is the highest people have been out and about shopping and recreation, really the entire pandemic and even to before the pandemic here in Niagara. And the consequence of all that mobility is people are interacting more. Their opportunities for infection to spread from person to person as a result of this. And that's of course the first and primary reason I think cases are going up. The second part of the story is of course the Delta variant. And this blue curve is basically non-Delta variant cases in the province. And this orange line are the Delta variant cases in the province. At least, the more recent part of it represents Delta variant. Prior to, about the summer, it represented non-variant cases. But the key thing here is you can see the non-Delta variants are basically at zero. There's nothing left that isn't Delta variant. And our increase in cases is entirely about the Delta variant now. And so that's the second big part of the story, that we are dealing with a variant that's more difficult to control. And so as we reopened, we gave opportunity for this very fast spreading variant to start to spread. You can see in Niagara here, this is our latest data of how our cases break down. And over 91% of our cases on screening look likely to be Delta, and everything else has been confirmed to be Delta. So we have Delta variant spreading here, and there's really nothing else. This is entirely a Delta variant surge at this point. And then the last part, I think, of the story of cases going up has to do with vaccinations. And this is the breakdown of Niagara's cases of the last 14 days. And you can see, most of our cases are unvaccinated people. Small bit is partly vaccinated, and a small bit is of fully vaccinated people. Over 65% of people are fully vaccinated, yet only 18% of cases are fully vaccinated, so disproportionately low. Whereas, almost 28% of people are unvaccinated, yet it's 69% of cases, so disproportionately high. And if we kind of do the math and look at how many more times likely is someone to get COVID-19 than a fully vaccinated person. So if you say a fully vaccinated person, if their risk of being a case is 1, a partly vaccinated person is about 7 times more likely to get COVID-19, and an unvaccinated person is about 9 times more likely to get COVID-19. And so, the group of people that we have unvaccinated, that 27 to 28% of our population that remains unvaccinated, that is the big part of the story of, why we're seeing a surge of COVID-19. There's still enough people there for COVID to spread and lead to lots and lots of cases. And, if we look at the federal government modeling, this wasn't unexpected. They said in midsummer that, we would see cases start to go up, but if we start to have more contact with each other, we could see cases start to go very sharply up. And I think we have gotten onto this trajectory with the reopening that we've had. And of course, there's not enough vaccinations to kind of temper that curve downwards. Hospitalizations is, of course, I think, something the province is really trying to shift the story towards. Minister Elliott no longer tweets the number of cases first and foremost. She's really trying to focus on vaccination numbers and hospitalization numbers. And the province, I think, is trying to sell the story that with vaccinations, cases aren't as important because, we're going to prevent a lot of cases and it's going to be about hospitalizations. Of course, I just showed you that we have most of our cases spreading in unvaccinated people, and unvaccinated people are going to be hospitalized probably at the same rates that they've always been, if not a bit higher, because of the Delta variant. So I do think cases are still going to be very predictive of what happens as hospitalization going forward. If you have more people hospitalized, more people who have cases, most of them are going to be unvaccinated. A percentage of them is going to continue to translate into being hospitalizations. And if you don't control cases, you're not going to control the spread of hospitalizations going up. until we get to a higher level of vaccination overall that, we just can't have as many cases, so we can't have as many hospitalizations. If we're looking at the hospitalization curve here in the province, you can see it is clearly heading upwards as those cases are going up. And likewise with ICU admissions, not quite as quickly, but there's definitely an upwards trend happening as the cases go up. Of course, there's lots of time before we start to see the level we had in the second or third wave, but it's definitely going up. And I do think there needs to be some action taken to make sure we don't get to the situations that we were in the past. In Niagara here, it's a bit of a similar story. We, of course, got to 0 hospitalizations for a bit, but with cases going up, that has started to go up. And likewise, the ICU admissions have started to go up as well. I showed you, cases were overwhelmingly in the unvaccinated on the order of close to 70%. This in Niagara over the month of August is what we can see with hospitalizations. And you can see overwhelmingly, even to a greater degree than with cases, our hospitalizations are in unvaccinated people. And again, let's do that analysis of how many times more likely is a person to be hospitalized with COVID-19 than a fully vaccinated person. So if a fully vaccinated person has a risk level of 1, a partly vaccinated person is 10 times more likely to be hospitalized. And an unvaccinated person is 21.2 times more likely to be vaccinated. So even more stark than with being your risk of being a case is your risk of being hospitalized if you did get COVID-19 goes far higher if you remain unvaccinated. And I think that's a really important part of the story here. And of course, if we can get more people vaccinated, we reduce the cases, we reduce the hospitalizations, and we avoid, potentially seeing another wave as bad as what we've seen in the past. And this is modeling put out by the Public Health Agency of Canada recently, and it pretty much shows exactly that. If we got 79% of eligible people to be fully vaccinated, you can see this curve here of hospitalizations with the gray being the different scenarios, and they've run a couple of thousand different scenarios, and this black line is the average. A lot of the scenarios show that we do end up with hospitalizations that exceed this red dotted line, which is a complete total national capacity. And of course, this is assuming we're going to be flying people across the country to wherever a hospital bed is available. We, will still in many cases potentially exceed. That's if 79% of eligible people get vaccinated. If we get that up to 83%, you can see we no longer really have those gray lines crossing that red dotted line. So we get to a place where we're safer. Hospitalizations are still higher than they were in previous waves. So it's still going to be a really bad wave. And of course, the higher we can get that number of people vaccinated, the lower and lower this curve is going to be, and the less likely we're going to have to really deal with a bad wave that could lead to our hospitals being overwhelmed. 83% here of eligible people being vaccinated is, kind of the target of where we would get to a point, at least nationally, where our hospitals wouldn't be at risk of being overrun. And if we take a look at where we are with vaccinations here in Niagara, if we're looking at the eligible group, we've got first doses to 81.3%, so we're getting closer to that 83% mark. We still have a bit of work to do, though, to get the people who got their first doses come back for that second dose. So, working hard to get these numbers higher. I want to highlight quickly the 12 to 17-year age group. We've had a Vax to School campaign going on over the last few weeks to make sure we get as many of our school-age children vaccinated before they get back to school. And you'll see here that unlike in past weeks, we've now got this age group higher than the next age group, the 18 to 29 age group. It used to be that this was the lowest age group in terms of vaccine uptake, and all of our efforts, I think, are working. We're getting more and more of this population vaccinated, and they're actually starting to pull ahead of this other age group. And so that is a good sign that if we keep plugging away at this, we can get the vaccination numbers up, and we are getting them up. Unfortunately, we don't have a lot of time on our hands. So, I've shown that as long as we have a fairly large number of people here who remain unvaccinated, there is going to be risk of that our hospitals being overwhelmed. And there's, I think, really only 2 options that the government is going to have going forward to stop this. First is, of course, what I showed here, which is if you get vaccine uptake higher, you can bring that hospital curve down and get it lower and lower the higher that vaccine uptake goes. And so, any sorts of policy measures such as the provinces announced for certain workplaces that are requiring people to be vaccinated. I think that is all part of the effort to try and get more people vaccinated and start to push down the risk that hospitals could get overwhelmed. The other option to prevent hospitals being overwhelmed is sort of a corollary of what we did for the second and third waves, where hospitals were threatened. There was a lockdown. We broke off the opportunity for people to socially interact. That slowed the spread of infections and allowed hospitals to start to recover and preserve their capacity because infection couldn't spread as much. And so we could go down that road again of having those sorts of restrictions. However, we could probably limit those restrictions to just the unvaccinated group because that's where infections are spreading. And if you slowed the spread of infection amongst the unvaccinated, there wouldn't be a lot more people and a lot more of opportunity for infection to spread. And so you could bring that under control. And we can see here Peter Uni, who's the scientific director of the Ontario Science Table, is very much talking about that. Now he describes how we've never been as open as we are now, and we can, we're not able to do that and still, not see cases and hospitalizations. If we want to continue being as open as we are, we need to protect the healthcare system from the unvaccinated because that's where the cases and especially the hospitalizations are. And we're only going to be able to do that if we basically start to restrict these individuals from the social settings that allow infections to spread. And then goes on to describe current reopening path will mean almost everybody who's unvaccinated is going to get COVID-19. And of course, that's going to carry risk of complications because of the Delta variant and going to lead to hospitalizations. But I think this is the key. We are either going to have some way to get hospitalizations higher, or the government is going to be forced to bring in restrictions, hopefully just on unvaccinated people to minimize the harm to the economy, to break off the spread of infection and ensure hospitals don't get overwhelmed going forward. And I don't think there's going to be really any other possibility than that. And I think if people are unvaccinated, they should take note of this because now's the opportunity to make sure you get vaccinated. So the government does go down this road, you're not all of a sudden excluded from attending some of these settings. You're going to still have the ability to attend those kinds of places. Last thing I want to do is just, with schools opening next week, just touch on, some of what we've been doing to try and keep schools safe, and hopefully we'll keep them safe. Just as a refresher, if someone has COVID-19, they can breathe out that infection, and a lot of it is going to be heavy droplets that'll fall to the ground, but there'll be some light aerosols that can stay buoyant in the air for a period of time. And we want to, of course, stop individuals from in contact with both of these to make sure that they don't get infection. First line of protection for schools is going to be vaccination. In Niagara, we made sure to make educators eligible for vaccination early back in April, in hopes that back then that we could actually keep schools open. Unfortunately, it didn't play out that way, but we, of course, do hopefully have a good proportion of our school staff vaccinated, so that's going to keep them safe. But of course, we've been pushing very strongly getting that 12 to 17 age group vaccinated to make sure that we have as many children vaccinated as possible, because that's what's going to hopefully give us our first line of protection to keep schools safe. We want to continue doing daily screening of people when they enter the school. So whether a student or staff, it's really important that parents do that screening for their children. If children have any symptoms of illness, it's really important they stay home, not go into school, to make sure they're not spreading infection to others. And of course, testing would be important there to find out, is that actually COVID-19 or not? Lots of work has been done by our schools to improve ventilation and filtration. And that's really about these fine aerosols that can stay in the air. If you're venting them out of the building, if you're filtering them out, that's going to make schools a lot safer. And one of the things we've been doing over the last couple of months is really trying to go out to almost every school in the region to check on all of the preventive measures they've done, and particularly have they done everything they can to maximize their ventilation and filtration to reduce that risk of spread as much as possible. Physical distance remains important. You want to space children out as much as possible within the school infrastructure, and that's another thing that we've checked on as we've done those proactive visits to school. Once kids come back to school, we want to make sure that they are wearing masks, and masks do make an impact, of course, because if someone's infected, they're blocking these droplets and aerosols from being breathed out, so it's not going to infect others. And on the flip side, if you're someone else and you have that mask, that's going to prevent you from breathing in some of these droplets and aerosols, and of course, keep you safe as well. And so that I think is going to be, another measure that's really important. And thankfully, we're not seeing some of the politics that they have in the US where there's opposition to wearing masks and efforts to try and stop people wearing masks. Our government, I think, has been very clear that masks remain important in schools. And I think that's really good. You want to, of course, make sure if anybody does get symptoms and is identified with symptoms on screening that we're testing them, and the province is piloting take-home testing. So that's hopefully going to make it even easier for children to get tested going forward. Where we do identify a case of COVID-19, we want to make sure it doesn't spread. And so, we're trying to limit children staying within cohorts of students. That's typically going to be their class, and then they'd recess and do other activities with that same group. So if there's a case of COVID-19 within that cohort, we'd unfortunately have to isolate that cohort and keep them home. But hopefully that means infection would only spread within that cohort because that person who's sick hasn't interacted with anybody else. And it's good that we've maintained those cohorts going forward into the school year. And we're really encouraging the schools to do as much as possible to maintain that kids stay just in those cohorts. And then, of course, we're going to continue having hand hygiene, to make sure that we're washing hands, cleaning hands as much as possible. Not the most important measure, which is why I put it last, but I think it does still make a difference. And so we're going to continue with that. And hopefully with this basket of lots of different interventions, despite seeing cases relatively high right now, we'll be able to keep schools relatively safe. Unfortunately, with cases as high as they are, cases are unfortunately going to get into schools. And because so many students are under the age of 12 and can't be vaccinated, unfortunately, I think we are going to see spread in schools and outbreaks in schools. But hopefully, if we're doing all of these things, we'll be able to limit that spread and do better than we were over the last school year, where we can try and keep schools open and really hope our children get through a full year of proper in-person learning. So I'll stop there and hand it over for questions.
Okay, first we have Abigail. You should be able to unmute now.
I'm good. I don't have anything.
Okay, thanks. Okay, next up we have Ludwig. You should be able to unmute.
Thank you. Hello, everyone. Hello, Dr. Hergy. The people who have tested positive for COVID and have presented to their healthcare provider after that, how are they doing, the vaccinated people? I'm just wondering, since the vaccine is intending to ease in the symptoms, I'm wondering how the people who are vaccinated and who did contract COVID, what shape are they in when they show up?
Yeah, well, the good news is that they're much more likely to get mild symptoms. I just showed you the data that they're much less likely to be hospitalized. So I think that implies that they're less severe illness. And then even with that pre-hospital level, it is more likely that they're going to have more mild symptoms. And so that's certainly, exactly what we are hoping to have from vaccination. It's just unfortunate we can't develop a perfect vaccine to even avoid that.
And a follow-up? I think muted again.
Thanks. Yes. So me and my partner went out to a mall, like one of those outlet mall destinations this weekend, and had a bit to eat and a drink, and walked around, did some shopping. People everywhere. Like it was extremely packed. And what I started thinking about was assume that we would end up in a situation again like we did last fall, where cases are spiraling out of control. One thought that just passed my mind was like, good luck trying to revert this now that people are getting accustomed to behaving like this again. So from a public health standpoint, what's realistic? I assume just saying another lockdown is going to blow the lids off small business owners, gyms, barbershops, stuff that hasn't been able to, and not to mention all these people who are venturing out here by the thousands probably each day to go to these destinations. So with that in mind, from a public health standpoint, how would we possibly deal with another wave that kind of is starting to show up a little bit in the graphs? Thanks.
Yeah, I think there's extremely little appetite for another lockdown. I think, though, that the government's hands would be forced if cases and hospitalizations start to get so high that our hospitals are overwhelmed. And they're back to the point where they're canceling surgeries, they're canceling procedures. People who need to get care are no longer able to get care. And when we start seeing what we're seeing in the United States, where people who need to be hospitalized can't actually get into the hospital because there's no beds. And I think our government would be forced to act if we started to approach that. In the previous 2 waves, that has meant going to a lockdown. I think there's an opportunity that we don't need to go to a lockdown this time, at least not a lockdown for everybody, but rather a lockdown just for the unvaccinated people, because overwhelmingly the infection is spreading amongst them. If you excluded them from all these social activities, to going to restaurants, to going to the mall, all of that, the risk of infection spreading actually falls very sharply. And you're perhaps not, and the risk of someone who is out there who does get COVID-19 then being hospitalized is extremely low. And so I think there's an opportunity that rather than seeing a lockdown, what we would see is basically a lockdown of unvaccinated people. We'd exclude unvaccinated people from these social activities, and the rest of the businesses would be able to continue catering to vaccinated people. That would be much less economic harm to them, and I think it would at least reward the people who've taken the effort to get vaccinated so they could keep operating. And I think that the reason why we've been pushing as medical officers of health that we need that provincial vaccine credential is so that if we do have to go down that road, we have a way to validate if someone is vaccinated. The last thing you need is that barista at the coffee shop is seeing vaccine records from some other province or maybe even some other country and trying to determine, is this person fully vaccinated or not, and trying to make a decision, are they allowed to serve this person or not? I think we need that provincial vaccine credential to make it really easy for business, if that kind of rule does come down, that they're able to say that this person is vaccinated, we can serve them, this person is not vaccinated, we can't serve them. And so I think that's how we avoid the lockdown, is by making sure we have that vaccine credential in place. And then if we do start to see the hospital system impacted overwhelmingly because we can't get vaccination rates high enough, we start to put restrictions on unvaccinated people. Hopefully we don't have to get to that, but I think that's going to be the outlet.
Okay, thank you. A couple people who didn't have questions. So up next we have Manisa. Should be able to unmute now.
Hi, thank you for taking my question. I was wondering if...
Sorry, Manisa, you're a bit soft. I can't quite hear.
Can you hear me now? Is that better?
It's a little better, yeah.
Okay, sorry about that. I was actually, there's a lot of talk about vaccine passports that might happen this week. And there were a lot of there was pressure from public health units for the Premier to implement something like that. So I was wondering if you were also, how you felt about a vaccine mandate, and if you were also on part of those public health units who are kind of pushing for that.
Yeah, so as a group of local public health agencies, it actually goes back to late July that we first requested the province needs to get some sort of provincial vaccine credential, what some people call a vaccine passport. I don't like using that phrase because I think it gets a bit too tied up to whether it's a travel credential or not, and we're not really talking about a travel credential here. But it's some kind of proof of your vaccination status that's irrespective of where you happen to get vaccine, that makes it simple and easy for others to validate your vaccination status. As I talked about in response to Ludwig, I do foresee a increasingly growing possibility that we're going to need some kinds of restrictions on social activity to slow the growth of cases and prevent our hospitals from being overwhelmed from the hospitalizations that result from that. And I think the vaccine credential in place really gives us the ability to then limit those social restrictions to just unvaccinated people where the risk is concentrated and minimize the economic harm that comes from it. I'm not sure we're quite at the stage yet where we need to start seeing those restrictions, at least on a broad scale. I think if we can identify provincially some targeted areas where we are seeing that impact, maybe it would be time to start to bring in a few very targeted restrictions. I think it's going to still be a little while before we start to see our hospitals overwhelmed to the point where we need to do something broader. But I think for the moment, we need to make sure we get that vaccine credential in place. We get it designed, rolled out, get a chance for people to have it, so we are ready when we do need to bring in those restrictions, that people have that credential in place.
And a follow-up?
Sorry, I'm still muted. Sorry about that. And how would you prefer that vaccine credential system look? And how long would you want it to last if it did come into play?
In terms of how it looks, I don't have very strong feelings. I can think of, for example, the example of Manitoba, where you basically got a plastic card similar to like a credit card, and that was basically your pass showing that you are fully vaccinated. I think it just needs to be something simple like that. Needs to have your name to validate who you are, and that's really it. And just the virtue you have that card would imply that you are now fully vaccinated. I think you really want to actually have minimal personal information on it to make sure that you keep things as private as possible for that individual. So I think that's in terms of all you need. And sorry, I forgot the second part of your question.
Sorry, it was just how long would you
Yes,
want
how
that to
long
be in
should it-
effect?
yeah.
Indefinitely.
Once you've issued that, it could be basically a permanent credential that you have in place. If it's a plastic card, it's not going to wear out for years. So I think it really could last years. I think the likelihood that we're going to need restrictions linked to that is probably closer to on the timeline of sometime over the next year. And probably by the time we're at this time next year, we'll probably be past the point where we need to worry as much about COVID-19, because either more people have been vaccinated, so they're going to be protected, and we're no longer facing surges and new waves and surges for hospitals. Or if people haven't been vaccinated, they have gotten COVID-19, they have natural immunity, and we're past the point where we're going to see that surge of cases as a result. And so, I think that credential could last quite a while, but it's probably only going to really be needed for about the next year or so.
Okay, next we have Penny. You should be able to unmute.
No, I'm good, thanks.
Okay, thanks. And then we have Gord. You should be able to unmute.
Hello. I wonder, Dr. Hergy, do you think the Niagara's 2 school boards should have a vaccination policy for their teachers and staff, maybe similar to what Niagara Health and other hospitals are going to bring in? I don't think they have a formal policy right now, the boards.
Yeah, I think it's important to note that the risk is a little different between a hospital and a school. Hospitals are often caring for elderly, possibly immune compromised, quite vulnerable people. We've definitely seen deaths occur of people who are hospitalized from COVID-19 in the past. And I think there's a lot more reason that you might want a more stringent policy for COVID-19 vaccination in a hospital, because this literally means, people's lives. Whereas in a school, the risk of someone dying is much, much lower. We have not really seen that. And so I think there's a lot less need to have the same stringency of policy. I would maybe advise that the school doesn't necessarily need to go as stringent as the hospital is. It's certainly a possibility for them. Right now, I believe what the province is doing is they're going to require a disclosure policy for staff in the school. And so people would have to reveal their vaccination status, and just by virtue of doing that, hopefully it'll embarrass a lot of people who've been complacent and haven't get around to being vaccinated to actually maybe go vaccinated. If you want to go a step above that, perhaps you could even have some, requirement that people need to, get a notarized statement similar to what students do for vaccinations in schools, such as for measles, where if they choose not to get vaccinated, they have to go through the hassle of getting a notarized statement to show that they're really, really serious, and it's not just a move that they're doing out of laziness. And I would advise that that's sort of the level that would probably be reasonable for schools. I don't think they need to go to the level of hospitals, but of course, schools are certainly welcome to do that, and I wouldn't discourage them from doing that.
And a follow-up?
Yeah, what sort of impact do you think something like a vaccination passport would have on vaccination rates?
The experience we've seen in other countries, such as France, or even other provinces such as Quebec, or most recently BC, when they've suggested that there might be some restrictions or even just brought out the vaccine credential, it's seen a spike of people coming out to get vaccinated. It, I think, does move a lot of complacent people who've just not got around to getting their vaccines to really go out and getting their vaccines, because now they're seeing how it's going to really impact their life in the near future. And I think likewise, if in Ontario, if we did that, we'd probably see a spike of people get vaccinated, which is, I think, another argument where it makes sense to get that credential in place. So not just that we're prepared for needing to have restrictions down the line, but hopefully we can even boost vaccinations in the near term, and that'll give us greater margin of safety to, maybe not see that surge of hospitalizations.
Thanks. So we've come to the end of the list. If anyone has a second question that they'd like to ask, if you can let me know in the chat and I can unmute you. Ludwig, you should be able to unmute now.
Thanks. Yes, and looking at the vaccine credentials, it's obviously a very controversial topic, at least in some segments of society. Even among people who are vaccinated, they're starting to sort of question the implementation of a new government mandated thing. And I suspect the things that you were saying about potentially putting restrictions onto unvaccinated people should the time come when the situation is such that it needs to happen. What's your sort of thoughts on the contention that might cause, and how is sort of the region and public health bracing to deal with that? Assuming that there is a provincial vaccine passport coming in, I'm sure there'll be more protests, etc. So if you could talk a little bit about that, that'd be great.
Yeah, I think that kind of credential, and particularly some sort of social restrictions linked to it, is pretty unprecedented in our society. We've not really seen those sorts of things in the past. And I'm very mindful that, we often talk about, anti-vax people or vaccine hesitant people or people who've been complacent and not got their vaccinations. And these are all people who are maybe being irresponsible, not thinking enough about the rest of society. I'm very mindful that there are people out there who have true barriers to getting vaccinated. They may not have transportation to get to a vaccine clinic. They might be working multiple jobs just to make ends meet and not have had time to get out to a vaccine clinic. They might be a single parent who's really busy caring for their child, trying to earn income, and getting out to a vaccine clinic hasn't been top of line. And there's people who are quite marginalized as a result who I think are going to suffer when these kinds of credentials, and especially if any restrictions come from it. So it's something that I would very much rather not see happen. But I think the flip side is we have seen 3 lockdowns in Ontario already. 2 of them were when our hospitals were basically on the brink of being overwhelmed. And the modeling shows that that is very realistically a scenario that could happen again, where hospitals are at the brink of being overwhelmed. And another lockdown would mean lots and lots of business owners would lose their income. Lots and lots of people who are employed by those businesses would be out of work again. There'd be a lot of social and economic harm as a result. And I think a lot of marginalized people who maybe depend on some of these businesses or are more likely to maybe work those, frontline service roles, they're going to be the ones who suffer the most from this. And it's unfortunate that we might need to go down the road of having some kind of restrictions. I think having the restrictions linked to being unvaccinated at least limits that economic harm or limits the harm to other people as a result. Obviously, the best case scenario here is more people choose to go get vaccinated and we never actually have to go down that road. But absent going down that road, if we're facing the choice of either letting our hospitals be overwhelmed so people don't get the care they need and possibly die, or we cause a lot of people to be out of work, we cause a lot of economic and social harm, I think it's unfortunately the least of the bad options that we limit that economic and social harm to unvaccinated people.
Thank you. And then we have Gord. You should be able to unmute now.
Okay. This is sort of a half question, half observation. I know about the effectiveness of the vaccines and what they've done in cases, but it seems like more often than not, when I see a breakdown of hospitalizations or new cases, and they're broken down by unvaccinated, partly vaccinated, and fully vaccinated, it seems like consistently fully vaccinated people make up a greater proportion than partly vaccinated, whereas shouldn't they be consistently far lower even than partly vaccinated people?
So that would be true if we had the exact same number of people who are fully vaccinated versus partly vaccinated versus unvaccinated. And all things being equal, of course, you'd see that very clear gradient where unvaccinated people are highest, partly vaccinated people less, and then fully vaccinated people the lowest. The thing is that 65.5% of our society is fully vaccinated. Only about 6.5% of people are partly vaccinated. And so there's 1/10 of them. So even if the risk was equal between those two groups, you'd see 1/10 the number of people there. The fact is we don't see 1/10 the number of people, we see maybe half the number of people there. implying that there is greater risk. So this is all about how many people there are at risk. You have 65+% who have a very low risk, and that adds up to whatever number we see. And then partly vaccinated people, about 6.5% at a moderate risk, and that's the risk we see. That's why I showed, when I showed the pie chart with the breakdown of fully, partly, and unvaccinated people, those bar lines showing what the actual risk difference is. And that's because it's such a small group that's partly vaccinated that it means that there's just not as many people, even with a higher risk, that you end up with very many people ending up hospitalized or being cases.
Okay, thank you. Looks like we've come to the end of the list for questions. So we'll end it there. Thank you everyone for coming out, and we'll see you again in a couple weeks.